Hey, let's go. My name is Dr. MarkAlain Dery. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as the co-chair for the ACOI Infectious Diseases Subspecialty Section. Welcome to our public health video blog, and while you know the ACOI best as the place to turn for quality CME for physicians, both online and in person, the ACOI has been working diligently to keep you up to date by sharing updates on the ongoing COVID-19 saga, as well as expanding our coverage to include other public health concerns. So I offer you this regular public health perspective, and now onto our story today, which is a public health perspective by yours truly, this guy right here. So let's talk about Omicron and have the vaccinations met their match. So here we are almost in mid-January 2022 in the U.S. We are seeing the highest COVID-19 case numbers ever. In fact, not just us, all over the globe. And we've seen at any point of the pandemic, not only globe, the country here in Louisiana, we're breaking records every day. These are not the records we want to break. How with the vaccine and with the majority of Americans being vaccinated, how can this be? In fact, so many people have asked me why vaccines don't seem to be protective against the Omicron variant, and this is what I like to remind people as to what vaccines do. The COVID vaccine and vaccines in general are designed to prevent the severity of disease, not guarantee that you won't contract it at all. The analogy that I always use is that vaccines are like seatbelts. A seatbelt does not prevent a car accident, but it will limit the extent of injuries. And the COVID vaccine and all vaccines are the same. It's ridiculous to think that a seatbelt's going to prevent a car accident. And just like you realize that if seatbelt can't prevent a car accident, we have to recognize that vaccines also don't prevent the disease. It prevents and limits the extent of severity of illness. Okay. But that has been forgotten by many of our patients who got the vaccine and thus have far been able to avoid any breakthrough infections, and who can blame them? We have all needed a ray of hope during the pandemic, and the vaccines have provided that. So in many of our patients' minds, the vaccine didn't just increase likelihood of catching COVID, it was almost like a guarantee. And clearly, that's not what vaccines are. So there are a few reasons we are seeing many more breakthrough infections with Omicron. The bottom line is that Omicron appears to replicate much more efficiently than previous variants, and if people who are infected have high viral loads, there's a greater likelihood they'll pass it on to others, especially the unvaccinated. Lucky, those of us who are vaccinated, and that's 98% of American physicians are vaccinated, which is an incredible number. I love that. I'd like it to be 99 or 100, but I'll take 98. So, like most of us who are vaccinated and may avoid it altogether or may have had some mild symptoms because the vaccines trigger multiple defenses in our immune systems, and that makes it much more difficult, if not impossible, for Omicron to slip past them all. Also consider that the variant showed up at a bad time, and that is when more and more vaccinated Americans were experiencing waning immunity from their first set of vaccines, and not enough people had yet gotten the booster by the time Omicron showed up on the scene. Take New York, for example. Take New York City, for example. The Omicron variant hit there first, and it hit hard. In mid-December, early on, in the Omicron spike, around 7,000 cases per day were being reported. Even though 71% of the population is fully vaccinated, yet just a relatively small percentage had actually received their booster vaccines. Also, as I have said earlier, the vaccines were not created to stop infections, but instead render them less dangerous and with reduced chances of more severe disease. Yet, let's not forget that about 40% of the U.S. population, and that includes children under the age of 5, remain unvaccinated. So infections will more readily spread amongst that group. Again, further straining our already overstressed healthcare system. In fact, with so many healthcare workers out and unable to work because they are sick, our hospitals are as pressured as ever, as I am sure you have seen in your facility. more infections are being uncovered since every patient who goes to the hospital for an elective surgery, for let's say, or childbirth or a broken hip, what have you, they're now being tested. And these are infections that individuals are going to the hospitals not knowing that they actually had. That means that there are extra precautions that must be taken with these patients to isolate them. And in most cases, the procedures they came into the hospital for are something they end up having to cancel, with, of course, the exception of childbirth. Okay, now at one New York hospital, it's being reported that about 2/3 of patients coming in, again, say for like a hip replacement or because of childbirth, or they have a broken leg, let's say, are testing positive for COVID, and these are incidental infections. Again, that's 2/3 of patients are coming in with this. And while Omicron is not creating as severe a disease as Delta did, but remember, Omicron is as virulent as the initial strain that emerged out of Wuhan. Think about that. But we're so much more and better vaccinated and have such a better ability to care for people in the hospital that our mortality rates, thankfully, are not as bad. But again, Omicron not as severe as Delta, but there are individuals who will be hospitalized by it. So adding the demand to the lower capacity the hospitals are now having due to many healthcare staff being sick themselves, as I'm sure you have seen in your hospitals as well. You end up with hospitals and teams of physicians and nurses and other support staff being on the short end of the stick, once again, feeling the strain of this pandemic as it enters its third year. And I should add that the lower staffing levels by many of our hospitals that many of the hospitals are facing is also being caused by high rates of burnout and resignation, and have forced many hospitals to operate with skeleton crews. But let me emphasize that COVID-19 vaccines are working so well that only a small percentage of breakthrough infections are actually leading to severe disease. The caveat here is that the Omicron variant, because it is capable of causing such large spikes in cases, because it is so transmissible, could translate to a relatively large number of people, potentially more than the system can handle, particularly on top of all these unvaccinated people getting sick. Projections are showing that the strain on hospitals will be felt more acutely in areas of the country where there are high numbers of populations that remain unvaccinated. This is to obviously be expected. These individuals are not protected at all and are more likely to suffer higher rates of complications and severity than those who are actually vaccinated. But projections aren't always right. For example, take the projections by some COVID forecasters and modelers who thought that the variant could bring something like 400,000 new cases every day, yet the reality is that we're already at nearly 700,000 cases a day, almost double the forecasts. So that means if Omicron is half as severe, but is causing it's twice the number of infections, we are sending the same number of people to the hospital. And even if the cases are less severe, there's always a chance that it can trigger serious illness or long-haul COVID-19. So, as usual, our message to our patients remain the same. Different story, same ending. Get vaccinated, get your booster, and not only wear a mask, but wear a high-quality mask, KN95, N95s. The cloth masks are gone. No more surgical masks. It's just a mask that has to be a higher quality mask. And of course, those masks cost money, and this is becoming so problematic, especially for some of our lower income clients and patients. All right. So, as we were saying, please wear a mask. Just as a reminder, as physicians, we are the most trusted source of vaccine information to our patients. This was recently validated through a Kaiser Family Foundation survey that found that 80% of survey takers agreed with the premise to trust their doctor first and foremost when it comes to vaccine advice. What we must remember is that the reasons why some individuals are vaccine resistant and have not gotten the vaccine, they're likely due to overt mistrust, or that people who just who believe in their personal autonomy and don't want to be told what to do by a so-called authority figure. With that in mind, research shows that if we as physicians just talk with our patients and not at them, that we are more likely to engage in a more meaningful dialogue that lets us talk through their concerns in a more objective and less judgmental way. There are resources out there to help physicians have those conversations, and they'll be linked to the sources below this blog on the ACOA website. And one more thing, some of us were interviewed by the ACOI media team during the Orlando convention, and an article in this month's ACOI newsletter coming out in the next few weeks will feature many of us recounting why it was important for each of us to be vaccinated. So be on the lookout for it by the end of January, and please make sure to read it. Thank you so much for tuning in. As always, you can find more information at the website at acoi.org /COVID. You'll find more information and about where these sources can be found. That being said, thank you guys. We love you guys. Thank you. Peace out.